Riverside Healthcare puts the health and wellness information you need well within reach.
And today on the podcast, we are joined by Michelle Stauffenberg. Michelle is a respiratory therapist at Riverside. Michelle, welcome to the podcast.
Thank you so much for having me.
Glad you could join us. And today we're going to be talking about smoking cessation and how important it is not to smoke, not be around smoke, and the health benefits of that.
Yes.
But let's first start with your background. You've been at Riverside
for, it'll be 32 years in June.
It's hard to believe you've been working that long. You must have started as a child. But in that time, always in the area of respiratory?
Yes. All 31 years I've been working in respiratory therapy.
And originally from?
I'm from Manteno.
So the area.
I've lived there my whole life and still live there. My husband grew up there as well. Yeah. And our kids now have grown up there. And so it's been a great community to live in.
Very connected to the community. That's wonderful. And how was it that you got into respiratory therapy and that kind of work?
I am a severe asthmatic, and I have been my entire life. And I remember going to the emergency room as a kid, and as I got a little older, thinking, this is what I want to do. I want to give breathing treatments. Yeah. And so right out of high school, I went to Kankakee Community College and through the respiratory program, and became a respiratory therapist, and I got hired at Riverside, and I've worked here ever since.
Wow, all in that same area. But as we were talking before we started on with the podcast, you mentioned even although it's all been in respiratory, a lot of different things you've been able to do.
Yeah, it's really been I consider it a blessing. It's been really neat to be able to do a lot of different things, and I have a real passion because I have a lung disease, and I've been able to help a lot of people in different areas, in different ways to manage their lung disease. I've done an asthma education program. We just recently did a program in pediatrics. I've been able to do pulmonary function testing, work on the floor, and currently I'm also working in the lung cancer screening program. So it's been neat to do different things within the field, but be able to help people with lung disease, which I can relate to.
Sure. Yeah, breathing's important.
Yeah, it's very important.
People need to breathe. There's no doubt about that.
Also, when you're struggling to breathe, it can be very it's taxing emotionally, physically, and I feel like I have that compassion because I know what that feels like. Yeah. So I'm happy to help people because it can be really hard to struggle with it.
Whether in water or any time you're unable to breathe or you have that feeling of, oh my gosh, I'm not going to be able to breathe, it is a panic-inducing thing. So I can imagine if folks that struggle with that really, there are, you said, emotional issues along with the physical component of it. And you mentioned the going as a child going to the ER because so that is some of your time, or there are respiratory therapists that get called to the ER at times when there are patients that need that help in the ER.
All the time, especially when I was on the floor. I mean, when a respiratory therapist who works on the floor in the hospital, we are in the emergency room a lot of the time for people with asthma and different lung disorders, giving them breathing treatments and, drawing arterial blood gases, things like that.
Yeah, and so, it could be a traumatic incident that causes breathing issues too, I'm sure. ER sees that.
Oh, yeah, definitely. That, illness, pneumonia, chronic illnesses, asthma, COPD, RSV for children. There's a lot of different areas and different reasons that we treat people for having a hard time breathing.
And as we said, we've established breathing is very important, yet there's something that people do that causes them breathing difficulties, but they continue to do it, and that, of course, is smoking.
Yes.
And smoking cessation is something that we offer, that is offered at Riverside. Talk a little bit about that program and how important it is.
At Riverside, we actually offer a freedom from smoking program. It's a program that we offer twice a year. It's a support group, which is really neat, and I've really enjoyed. I've been a freedom from smoking facilitator for about 8 or 9 years now. And at first I thought, well, maybe I won't be good at it because I've never smoked because I have asthma. I've always been sick. Yeah. But I bring my dad along, who actually finally quit smoking, is struggling with COPD, and he's fantastic to share. He can really relate to what they're feeling, and I can relate to what they might feel like if they don't quit. Yeah. Because I know what it feels like to maybe short of breath. But we offer that program, and it's a really neat program. The first 3 weeks we prepare to quit. Week 4 we quit. And the last 3 weeks we support each other. Yeah. And it's been very successful. So we offer that. We also, as an inpatient, if you're at Riverside, somebody will go up and talk with you about freedom from smoking, give you information. If you're going into pulmonary rehab, we follow up with that as well. We do have the lung cancer screening program, and we heavily talk about smoking cessation there. I do follow-up calls with everyone I see to see how they're doing, see if there's anything else we can do for you, give them additional resources to help them, because this is it's an addiction.
Yeah. Well, it sounds like a very thorough program.
Yes, we do. We try really hard to help people.
Yeah. I love the name of it, Freedom from Smoking.
Yep.
It has more of a positive,
Yes.
goal-oriented kind of name as opposed to just quitting, which is
Right.
important. But just the word choice makes it.
Freedom.
I think, yeah.
And I love when people actually quit and I can say to them, you are a non-smoker. And
Yeah.
even if it's been 2 days, they're like, I am. I'm like, you are.
Yeah.
So it's really been a neat, I've enjoyed it. And we get really close for those 8 weeks.
Yeah.
And we celebrate at the end. Our class gets to choose their celebration. We've gone to different restaurants and you really feel a
Sitting
connection.
in the smoke-free section.
Yeah, yes.
There isn't a smoke-free section anymore because now in Illinois, anyway, there's no smoking,
Thankfully.
which is great. Has been a blessing, I'm sure.
Mm-hmm. Yes, very thankful. For people like me, I'm so thankful I can go and not have to be around that.
Yeah.
So yes.
So there's a celebration when everybody's done, and do you track the success rate? I'm sure, like with any addictive behavior, you quit, but some people fall off the wagon, so to speak, and get back to it, and it may take a few times before they're finally successful for the long haul. Do you find that?
Yes, definitely, and we do try to track. And actually, it's interesting when I've talked to past people from my classes, they really want us to do a follow-up program. So we've actually talked about that, and I think we might be implementing something like that. For anyone who's came through the program, they can maybe once a month or every other month we meet and continue to support each other because that is key. Because nicotine, I don't know if I'm getting ahead of myself here, but nicotine is a highly addictive substance. It's been what I've read, it's up there with heroin and cocaine, and people think, oh my gosh, but it is. Yeah. It passes the blood-brain barrier in 10 seconds. So it's not just, someone doesn't have willpower or it's a bad habit. It is an addiction. And when I went through the program to get certified, I really gained a real compassion for people because it's an addiction. And, a lot of people they don't know that when they start.
Yeah. Well, with that thought in mind, how is it that you start when people first start the program? What is it you do to help them kind of get a handle on it and set the path for them to be able to quit because it is so difficult?
We talk a lot about we take 3 weeks to prepare. So we talk about what do you think triggers you? What do you think causes you? We have something called track packs, and they fill them out. And when they smoke, they put, am I happy? Am I sad? Am I stressed? And you would think people would know that, but they really don't until they really consciously look at it. So we help people figure out, why am I smoking? What triggers me to smoke? What are my fears of quitting? What are my motivations to quit? Family, people I love. I want to be here. That's the big one. My health. But finances, it's become very expensive. Yeah. So people, we talk about, what are you going to do with the extra money? And people plan vacations or want to buy a car or things like that. So we really prepare, but we really talk a lot about, it's a 3-chain link addiction. It's physically, it's socially, and it's emotional or mental. So we really try to dig deep as to what's causing you to do this. But we know the physical addiction at this point is what's really driving it. But what triggers it? Yeah.
In those first 3 weeks, is there something you're doing to help with the physical component? Is there something you can do to prepare to quit physically that's going to help better the odds you're going to be able to do it?
We talk in depth about medications and different nicotine replacement programs. Nicotine is highly addictive, but also in tobacco, there's over 4,000 carcinogenics in the tobacco. So we ultimately want to be tobacco and nicotine free, but if nicotine replacement will help the person be able to stop the tobacco, that's a good thing. So we talk about patches, and I've seen a lot of success with that. Gum. We talk about, there's different inhalers, nose inhaler. We talk all about that. And then there's also prescription medications that they can go and talk to their physician, like Chantix and Wellbutrin. There's different medications that do something in the brain to help prevent the urge. Yeah. So we have a whole section on that we talk about. We talk about it every week, but we really talk about it prior to and then people make a decision. Is this something I want to do?
Yeah. So talking to your primary care provider is part of the process.
Yes. For anything. I even recommend if they want to use some, a patch or gum, because, nicotine can affect the blood pressure and the heart rate and things like that. And so we want to make sure that if you start on something that you're not starting with more nicotine than you already had. So we recommend having your primary care involved and then talking to a pharmacist maybe in regards to, okay, this is how much I smoke, where should I start with these over-the-counter things?
Yeah. You mentioned the social component and family. Does family get involved? You mentioned you bring your dad.
Yes.
Does family get involved? And I have to think that if they do, there's going to be better success rate if they've got loved ones who are helping them.
Definitely.
As opposed opposed to, hey, I want to keep smoking even if you're going to quit, which I'm sure comes up as well.
Definitely. Families welcome to come. I've had a few classes where a spouse will come. Not a lot of times do they bring their family members, but they're always welcome to. And that is key, because one of the things I find that's difficult is a lot of people say, well, my husband or my wife smokes. That's hard to quit when someone else is still.
Yeah.
So if you can do it together, and a lot of times, but I have had people bring their spouses, and it's very good. It's supportive. So yeah, I mean, I think support is very important. That's why I think our program is effective, because even if they don't have the support at home, they have each week to come together and share, and they can all relate.
Sure.
That I'm struggling. I've had people say, I feel like I'm losing my best friend.
Mm-hmm.
And then other people say, I know. Where someone who hasn't been there doesn't get that.
Yeah.
But to have someone say, I get it, that's why I bring my dad, because he can get it more than I can.
Sure. Yeah.
So
Now, I'm sure some people who have smoked a long period of time think, well, I've already done the damage. What's the point in quitting now?
Mm-hmm.
But there is a benefit. No matter when you choose to quit, there's still going to be health benefits to that. Is that correct?
Definitely. And I actually brought a little sheet, Carl, that I'd like to refer to, because
Sure.
I hear that all the time. I've smoked for 50 years. It's too late. And it's not. And you will get health benefits within 20 minutes after you quit. In 20 minutes, your heart rate and your blood pressure drop.
Wow.
In 8 hours after quitting, carbon monoxide level drops in your blood, and oxygen level in the blood increases to normal. 48 hours, nerve endings start to regrow. The ability to smell and taste gets better. I mean, so very quickly things improve, because one thing we teach in the Freedom from Smoking class is smoking is not a normal state.
Yeah.
And so your body is trying to always get back to normal. So quickly it will try to once you've quit. And then, like, I don't know if you want me to go on, but there's 2 weeks, 1 month.
Sure.
I mean, up to 10 years. So, I mean, after so many years, you are almost at the same risk as a non-smoker for certain diseases.
So all those benefits when you quit almost makes me want to start smoking just so I can quit.
So you can have a lower blood pressure.
That probably doesn't make a lot of sense, though.
No, do not start, Carl.
Well, one of the things you mentioned also was our Riverside has a lung cancer screening program.
Yes.
Talk a little bit about that.
It's a fantastic program. It is a free program. I'll say it again, free, because nothing's free.
Right.
And you do not need a physician order. You can refer yourself here. And if you are a current or past smoker, depending on the different, I think it's 30 days, 1 pack a day or more. But like I said, I don't know all the exact
30 pack years, I think, is the term they use, which means a pack a day for 30 years. Mm-hmm. So that's 1 pack a day, or 2 packs a day for 15 years.
Correct.
Or some combination.
Mm-hmm.
There is math involved, but some combination like that. So if you smoke for a period of time, the testing is free to you.
Then you're eligible. And don't get hung up on what we just said. I mean, call. If we will let you know. If you think that that's something you want to do, call and try to make an appointment, and we will let you know if you're eligible. But yes, you come and you get a free lung CT.
Yeah.
And then if you're a current smoker, you also get a free pulmonary function screening for COPD as well. And so that's what I do, Carl.
Yeah.
So that's been really a neat thing to be a part of.
Sure.
And then of course we follow up afterwards with everybody to see if there's anything we can do to help them in becoming smoke free.
And as I understand the program, they test for 3 years, so they'll see if there's something, they can monitor it and see if it's something that then in turn you go on to get taken care of.
Yes, sometimes they'll find a nodule very, very small, and they'll just follow it, and it becomes nothing. Sometimes everything's fine, and then sometimes we do find things, but by catching it early, lung cancer, we come a long way, and there's a good survivorship. So catching it early, so that's why we do it, and it's free.
Such a huge benefit to catch those things early. Well, Michelle, if somebody hears this and they want to take some action, how can they contact you? What should they do?
They could, if they want to call and schedule for the lung cancer screening program, they could. Should I give the number?
Yeah, absolutely.
They can call 815-935-7531 is our outpatient scheduling department.
And give that again.
815-935-7531. I hope I gave the right number, Carl. I'm pretty sure. Anyway, they can call and get information and get scheduled. They could always call our respiratory care department for information, 815-935-7517. Any of the respiratory therapists would be happy to talk more about our programs.
And there's information on the Riverside website about all that as well.
Yes, there is. And you can even call the main hospital and say, I want to talk to somebody about freedom from smoking. They'll connect you.
Yeah.
So there's lots of ways, and we are here to help, because definitely, smoking is the number 1 cause of emphysema. So it's so important to help people. And not only is it just the lungs, it affects every organ in the body. Nicotine narrows the blood vessels to every organ. So it's not just your lungs, it's your whole body. And we want to really help you be the healthiest you can be, so you can enjoy your life and enjoy your family And, so we have a mission for this right now. We really do.
That's great. Well, we appreciate you coming today and sharing all the information. Is there something else you want to mention?
There might be one more thing.
Sure.
A couple other things. There's an Ellenoi Quit line that is a fantastic resource. You call there and you get a coach. And I've heard it's amazing. And I heard the coach is available almost 24/7 for you. And you can do it from the convenience of your home. Mm-hmm. And they also, I've heard if you stay connected to their program, that they will send you free gum, nicotine gum or patches.
Okay. I like that idea.
Yeah.
Free gum.
And I can give the phone number as well for that.
Yeah, absolutely.
1-866-QUIT-YES. 1-866-QUIT-YES, which is 1-866-784-8937. But it is a fantastic program that I've heard a lot of people have really enjoyed. And it's not intimidating because you can just do it from home and call. You don't have to go somewhere.
Right.
If you have a busy schedule, you could still make a quick phone call and talk to your coach.
Yeah. So there are a lot of resources available.
Yes.
So if someone is struggling with quitting, there are a lot of options for them to look into.
And even something just to mention, a lot of people that I follow up with, they say, okay, yes, I've cut back. If I smoked 20 cigarettes a day, I'm going to do 15 for 2 months. Mm-hmm. And then I'm going to do 10 for 2 months. And I just want to stress that even cutting back matters. Yeah. So, and another thing we teach in our Freedom from Smoking class is if you've been smoking for 30 years, you've practiced that addiction, that habit a lot. So even if you've tried to quit smoking in the past and you haven't been successful, it's okay. It's going to take practice to quit as well. Yeah. So even if you weren't successful, I'd think about, okay, what triggered that or what caused me to relapse, and do it again. Don't give up, because this could be the time that you are able to beat it. Yeah. So don't give up. I would really want to encourage hope that you can. Millions and millions of Americans have quit smoking, and you can too. Yeah. And we're here to help. For sure.
Very good. Well, Michelle, we appreciate you coming by. Michelle Stauffenberg, respiratory therapist at Riverside. Thanks for sharing all that great information.
Oh, you're welcome. Thank you so much for having me.